Hi, I'm Dr. Claytor here with Heather at Claytor Noone Plastic Surgery, and we're examining a very nice patient today who had a tram 20 years ago and then subsequently had a modified float tummy tuck. So go ahead and open your gown and let it drop to the floor. Perfect, excellent. And so we can see her scars are down here and they're very well hidden, and her belly button, which was up here from her tram. So this is where the muscle was taken to reconstruct her breast. And so when we went back, I lifted up the belly button and floated everything down here. And so this is a conversation that we have with patients frequently about the difference between a modified float tummy tuck or a full tummy tuck. She couldn't have a full tummy tuck because she's already had part of her abdomen removed for her tram. So the incision is nice and low and has really created a lovely sculpting of her abdomen. Go ahead and turn and bleed. We can see a nice figure of 8, and her belly button is nice and midline, and actually before it had been pulled off to the side, which is very common with a tram operation. She has no rectus muscle here, that's been removed. And the incision is down here and nice and, very, very minimal. And boy, she can wear a bikini. And this is a nice young lady who's in her mid-60s, and she's bikini ready for the beach. So, Heather, what sort of conversations or questions do you think might come up?
Well, so you said you did a modified float, correct?
Exactly.
So you actually, what did you do with her belly button? Did you have to remove it?
Perfect. What I did is I made the incision down here and removed the extra tissue. And then you can see it went all the way around the side. I dissected all the way up to the xiphoid. And as I came up, previously she'd had a cut around her belly button and left the belly button attached to her abdominal wall. Here I went up and released or floated the belly button. So it had been here and I lowered it down. And so by moving the belly button from her middle of her abdomen down a little bit, it actually makes her whole trunk look taller. So she's not so tall, she's just a little bit more than 5 feet, but this will actually make her look taller in her midsection. So that's a great question.
Right. Because with the scar she has around her belly button right now, that was from a previous surgery.
That was from 20 years ago.
Right.
Right. The incision that we made is down here and is super well healed. But there was no incision that I had to do there because I went up and I released the belly button from there and was able to float everything down here. And that's why we call it the modified float tummy tuck. What are some other questions that patients have when they're getting ready for abdominoplasty tummy tuck surgery?
Well, oftentimes they want to know the recovery time, how long that they'll be out of work.
Yeah.
And how long they'll need someone to help take care of them.
Generally, it's about a month for full recovery, and that means you can kind of go and do your maximum activity in a month. And that's even for a patient who'd had a previous tram and then subsequent modified float tummy tuck. That's probably one of the biggest questions that we always get afterwards is, when will I be able to get back to my regular activities? And then the other question is about drains.
No drains.
No drains generally, which is fantastic and really maximizes and gets people back to their regular activities. I let them shower one day after surgery. So, well, thank you so much for joining us for the modified float tummy tuck.